Hey, are you suffering from knee arthritis? And are you wondering if your knee arthritis problem can be cured? Well, the answer depends on how you define a cure. And I'm going to give you a definition that is not mainstream medical. It's probably going to shock you. So you want to listen to the whole video to make sure that you fully understand how I define a cure for knee arthritis, because it may help you out tremendously in getting back to being healthy, active, and mobile again, despite your knee arthritis problem. I'm Dr. David Medoff, and I'm a specialist physical therapist from Paso Manual Physical Therapy. This channel is focused on making videos to help you keep healthy, active, and mobile while avoiding unnecessary surgeries, injections, and medications. Be sure to subscribe and turn on your notifications so that you don't miss out on any helpful tips that we share each week. Now let's talk about knee arthritis. To be specific, I'm talking about knee osteoarthritis. I use arthritis synonymously. I use them the same, but really there's different types of arthritis: psoriatic arthritis, rheumatoid arthritis, and others, but I'm not talking about those. I am talking about osteoarthritis in the knee, but I'll be saying arthritis because that's kind of what everybody says anyway. My answer regarding knee osteoarthritis is yes, it can be cured. Now, the intent of this video today is not to teach you how to fix your knee arthritis problem, but instead to give you a different perspective on what a cure is, because it gets confusing how the medical field defines a cure. Now, if you're looking for a video on how to fix knee arthritis, I've linked several below in the description, as well as a link to our 28-day knee health and wellness boost program. You can learn more about that in the links in the description. My intent on today's video is to get clear on what a cure really is. If you define a cure for knee arthritis as having an X-ray, an MRI, or a CT scan of your knee that looks completely brand new, as if your knee never had any arthritis at all. So you've been diagnosed with arthritis in the past, then you did some sort of treatment that cured your problem, and then you had another X-ray, MRI, or CT scan, some sort of imaging done on your knee, and you're expecting for that image to be completely clear of arthritis. If that's how you would define being cured from knee arthritis, then in those circumstances, knee arthritis is not curable. The fact is that if you've been diagnosed with knee arthritis in the past, if they found knee arthritis in your imaging, in your X-ray, MRI, or CT scan, then you will probably always have some evidence of knee arthritis in the future if you have another knee imaging study done. If you have any X-rays, MRIs, or any of those things that I mentioned, you will probably always show up with some knee arthritis on your imaging findings. But that doesn't mean that your knees are going to be hurting. And doctors will tell you that you have arthritis. They'll probably tell you there's no cure for it. They'll probably say you're always going to have this on your X-ray whenever they look at the films. And they're just going to look at things that they can do for you that can alleviate the pain in the short term. Because that's what physicians do. They prescribe medications, they give injections, and they refer you out to surgeons. And of course, surgeons do surgery. That's what they're trained to do, and they're good at it. And I'm thankful that we have physicians and surgeons out there, because sometimes we need medications, sometimes we need injections, and sometimes we need surgeries. The fact is, that's not their specialty, fixing, curing knee pain. The fact is that curing knee arthritis is not their specialty. Their specialty is treating the symptoms of pain from knee arthritis. That's why you get the medications, injections, and surgery. What's missing from this definition is how your knees feel. Because when you look at that X-ray, the MRI, the CT scan, or if you have that paper, that report from the radiologist, and you read all the big medical words that sound terrible, like degenerative arthritis, and loss of cartilage, or the doctor says something like bone on bone in your knee, then it can feel bad. But the reality is your knees can feel painless despite having those findings. So given that knowledge, and this is scientific medical research that's been done, by the way, let me just briefly explain this to you. There has been studies done where they've had people with knee problems and people without knee problems all get MRIs, and they give the MRI findings to radiologists, which are physicians that know how to read X-rays and MRIs and all that. And they tell them to categorize who has pain and who doesn't have pain just based on the MRI findings without ever having seen the patients. And they can't consistently do it. The MRIs, the X-rays, those are not the final definitive tool used to define a person's function or ability to live without knee pain. Now, it's clinical arthritis, regardless of whether or not you have knee pain. So I invite you to adopt a different definition for a cure of knee arthritis. If you're watching this video and you have been told that you have knee arthritis, or you suspect that you have knee arthritis, your knees might be crunchy, you might be stiff in the morning when you get up, it might be tough to take your first few steps if you've been sitting for a while. Maybe it runs in the family, your mother or your father had knee arthritis, your grandparents also had knee arthritis. That doesn't mean that you're going to suffer from knee arthritis. It means that you likely will get knee arthritis, but it may not even hurt you. You may be able to do all the things that you want to do despite having clinical knee arthritis. So don't worry about a medical cure. What I would have you worry more about is, what can you do with your knees right now? And how can you feel with your knees the way they are? Because if you look at it that way, if you disregard the MRIs, if you disregard the x-rays and the CT scans, and you focus more on what's really in your control, on how you move, how you strengthen, how strong your muscles are that support your knee, then you can take control of your knee arthritis problem, and chances are you can diminish the inflammation inside the joint, you can move better, you can become better at tolerating walking, being able to stand for longer periods of time, you can get all your range of motion back. And as long as the arthritis isn't too severe, you can probably get back to even exercising without worrying that your knee problem is going to get worse. If this is the definition that you adopt as far as being cured from knee arthritis, then you're going to have a much better chance at truly fixing this problem. Because if you take on the definition of, the doctor said that I have knee arthritis because of the x-ray and the MRI, then you're allowing that doctor to label you as being unable to get better. But the fact is that you can get better, you can get stronger, you can walk better and bend better. Now let me take you on a brief tangent that I'm going to bring full circle back to knee arthritis, just to give you a different perspective on this. Let's talk type 2 diabetes. Now there's different types of diabetes, but type 2 diabetes is the one that is kind of a pandemic in the world right now. It's the one that people have from as a result of not eating well, of having poor eating habits and poor exercise habits. What is required of somebody with type 2 diabetes who's been diagnosed, labeled as having type 2 diabetes, is in order for them to get rid of the type 2 diabetes and be normal again, they have to change their eating habits and their exercise habits. And then they have to keep up those changes over time. If this is done, they can avoid taking any medications for diabetes. If it's not done, then what tends to happen is they'll go to the doctor will tell them, hey, your blood sugar's pretty high here, you're clinically diabetic, you have type 2 diabetes. I recommend this first medication. Usually it's metformin. There might be others out there, I'm not a medicine specialist. A low-level diabetes medication will help an individual with type 2 diabetes to control their blood sugars so that their diabetes problem isn't getting worse and affecting other organs. If that person doesn't change their eating and exercise habits at that point, what will eventually happen is their body will continue to worsen as far as the diabetes. Their ability to process sugar in their body will decline. And that initial medication that they've been on will then start to not work. It won't be effective. Then they'll go back to the doctor because they might be having some other symptoms, or they'll go for their checkup and the doctor will say, hey, I know you've been taking this medication, but your sugar is still kind of high. I recommend a more powerful medication. And it's just a matter of time before certain organs start to shut down. The common one is the pancreas. They don't develop enough insulin, which is important for regulating sugar in the body. And then you're taking some hard stuff like insulin to manage your diabetes. You're essentially taking the chemical that your pancreas is supposed to produce because it can't produce it anymore. You have to get some synthetic insulin and inject it into your body to manage your blood sugar. That situation is so preventable had that individual begun to change their eating habits and their exercise habits way at the beginning. But I've had honest conversations with doctors in this situation, and doctors can look like the bad guys in this situation because they're not seen as talking to their patients about exercise and eating right. But in reality, they do. They most of the time will mention that, hey, you should be eating right and exercising more so that you can manage your weight and your blood sugar and all that, so that you're not having to take these medications. But in the scenario where a doctor just has a few minutes to talk with their patient, and what my doctor friends have told me is, I've been talking to my patients, and I just get the sense that I don't think they're going to change their eating habits, and I don't think they're going to start to exercise more and burn the calories needed to manage their blood sugar for the long term. And as a doctor, I feel ethically responsible to give them this diabetes medication in the short term so that we can prevent them from getting worse in the short term. Having a change in their diet and exercise is more of a long-term change, and that's not something that physicians are well suited to do in the current medical model, where they just see them for a few minutes every few months or however frequently they go to the doctor. It really requires a daily change in order to fix a diabetes problem at the root level, which is diet and exercise. Diabetes is really the symptom of the deeper root problem, which is diet and exercise. Now let's talk about knee arthritis again. It's the same scenario. Knee arthritis is a symptom of the root problem of some strength issue and movement problem that over time has led up to that knee joint getting irritated over and over again, and then it develops knee arthritis. That's why, from the medical perspective, there isn't a cure for knee arthritis. There isn't a medication that you can take, an injection that you can have, or a surgery that can be done to cure knee arthritis. And doctors in the short term are giving patients medications, injections, and recommending surgeries that help to mitigate the short-term effects of knee arthritis, the pain, the loss of motion, the inability to sleep at night because of the pain, and being able to get up and do things because of the pain. There are treatments to help with that, with those symptoms of knee arthritis. But fixing knee arthritis for the long term, where you have clean MRIs again and x-rays, there just isn't a cure for that. What is definitely more reasonable is if that person with a knee arthritis problem starts to exercise again in the right way, and there does need to be a strategy for it. There's certain exercises that are very, very important, and there's certain muscles that are really important to get the pressures right in the knee joint so that that knee joint can reduce in inflammation and become pain-free again, and be able to tolerate more exercise without getting more inflamed so that that knee joint can become healthy again. There's a big strategy behind that. And go check out those links in the description below if you want some videos to find out where to start. But the fact of the matter is, if you have seen your doctor for a knee arthritis problem, or if you're planning on going to go visit your doctor for a knee arthritis problem, they're probably only going to have short-term solutions for you, because the real root of the problem is at the exercise, strength, and movement level, which just isn't their specialty. And they'll probably refer you to a physical therapist if they recognize that. But even then, with physical therapists, there's a subspecialty of physical therapy where they focus on that. Most physical therapy focuses on helping people after they've had a surgery, like after a knee replacement, a meniscectomy, or something like that, which they're fantastic at doing. They're fantastic at getting the range of motion back and being able to get the person back to walking again. But fixing the underlying strength problems, the muscle imbalances, that's a whole different specialty, which is what I focus on. I'm an orthopedic manual physical therapist, and I specialize in helping people out in that scenario. So I hope that you've learned something in this video. I hope that you've changed your definition of what a cure could look like for knee arthritis. If you're expecting to see clear MRIs, clear x-rays, it's not coming. But what you can expect is for your range of motion to get better, for your inflammation to go down, which in turn should mean that your pain should improve, and for you to be able to tolerate being on your feet more and being able to get up quicker. And one more thing I want to mention, because this is probably going to come up in somebody's mind: knee replacements. Knee replacements, they literally open up the knee joint, cut out the ends of the knee, and put in artificial replacements, metal pieces, prosthetics in there, so there's no more arthritis. Technically, it can be seen as a cure for knee arthritis. And if you had an x-ray of that replaced knee, you wouldn't see any knee arthritis. That would probably be the only situation in which the knee arthritis would be gone. But I want you to think about this. You still have to answer the question of what created the knee arthritis problem to begin with. How did that individual get to the point where their knee got so bad that a surgeon out there agreed with them that they should replace their knee, and they went through the procedure and had a knee replacement done, you have to ask, what was the underlying root problem, and was it ever addressed? Because if it wasn't, if there's still a muscle imbalance, if there's still movement problems, which oftentimes gets worse after having a knee replacement because it is major surgery. I'd say it's one of the most major surgery aside from having a heart or a spine problem, a spine surgery done. It's a joint replacement. You will get weaker. You will move differently after a knee replacement. It takes close to a year to recover from that knee replacement. If those weaknesses and movement patterns have not been addressed, they are likely going to still be present after that person has that knee replacement. And that usually sets that person with a knee replacement up to wear down that knee replacement quicker than normal, or to affect a joint nearby like a hip or a foot problem, or the other knee will become affected too because of the way they move differently. So it's still not a cure for knee arthritis in my opinion, because it sets up other problems. The root problem, just like with type 2 diabetes, is diet and exercise. In diabetes, in a knee arthritis problem, the root problem is a strength issue and a movement issue, the way that the individual is moving. So I hope this video was helpful for you. Comment below if you feel like your perspective on a cure for knee arthritis has changed, and give us a like, please, if you thought this video was helpful. Don't forget to subscribe and hit that notification bell so that you can get notified whenever we release helpful weekly videos. Thanks so much, guys, and we'll talk next time. Bye-bye.